Hi, Ross. So we're back today discussing quite a few events, mainly focus on cannabis scheduling discussion that was hosted during an event with Wesgro and SAHPRA and the Department of Agriculture. And Ross, I know you also at a cultivator today, busy with getting ready for an inspection tomorrow. So, are you ready for that inspection on your side?
Yeah, look, it's been a long day. I mean, I got you, sure. It's about a 2 hour drive out to the northwest. So, yeah, I got you just after 8 o'clock. Put a lot of work in. We only finished at about, sure, 7:30 tonight. So, yeah, it's been a long road, but yeah, they're ready. I wish I was here the previous week to get them ready for the GMP one. I kind of just walked in here hoping they were ready, but there's quite a bit of work to be done. So that's what I was here today for. And let's see, I'm pretty confident they should get their resolution after the next 30 days after tomorrow. But yeah, went well so far.
Okay, good. Yeah, I know that we're also going to have them on this channel, kind of going through the facility, getting familiar with what the activities, similar to what we've done in the past with one or two license discussions. So let me jump into the actual event that took place with SAHPRA. For me, it was quite instructive. I know we've had a discussion previously on the channel where we engaged with Bio Africa's event with SAHPRA, and the compliment we gave SAHPRA was they had answered a lot of questions, which they did again in this discussion on Wesgro. I see Wesgro haven't published it as of the date we're discussing it, the 4th of May. It was about 2 weeks ago, not shortly after the Bio Africa discussion. But I really thought it was important to, I was hoping it would be published, the actual whole webinar that went through it was a public event. I wanted to highlight 3 specific points related to questions I'd asked SAHPRA and that they responded to. And the main respondent was Ms. Omaji, who's responsible for scheduling at SAHPRA on CBD and THC. So I'm just going to bring it up right here, which is the question I had for SAHPRA was, could you discuss the regulator's view on scheduling of minor cannabinoids like CBG and CBN? And for anyone at home who doesn't know, these are very popular in the North American markets and also into certain European designations where it's allowed. And there's some interest. There's going to be more and more interest in minor cannabinoids. That's for certain as we discover more about the plant. And the response for me was clear, and I think it needs a discussion. So the response was from SAHPRA that the cannabinoids will fall under the Schedule 6 listing until enough data is received to schedule individually. Now, I personally took issue with this. I'm glad there was a response. So my thanks goes out to SAHPRA for responding. But I do go back to the actual documentation that was published on the 22nd of May of 2020, last year. And specifically, it moved previous entries of cannabis, dronabinol, and THC out of Schedule 7, and it was deleted, which means cannabis as a plant was deleted from Schedule 7. The way I read it and the way I interpret it, and I'm pretty sure my interpretation of English is half decent. So the thing that did come from it was that CBD is scheduled under 4 and 0, and the specific requirements around that is well published and discussed. And the same for trans delta 9 THC is at Schedule 6. So no disagreement with that. There could be modifications and improvements, but I am a little stumped by the response that CBG and CBN are scheduled under 6 because I don't see that in writing. And I think this is something that needs to just be mentioned from our side. It's been a question that's gone up and down on minor cannabinoids. This is the response from the regulator. I would like to see that these eventualities are built into the discussion from a regulatory standpoint, because how are you supposed to know? If you didn't attend this webinar, you didn't ask the question, and you had a product that was a broad spectrum product that was proud to say that it had CBG in it, you would actually not have a broad spectrum Schedule 0 product. You would have a Schedule 6 product that contains CBG, even though it's mostly a broad spectrum product, and maybe that broad spectrum refers to terpenes. And now here's where my next question came in, and this didn't get answered, because once they had responded saying CBG and CBN is Schedule 6, I said, what about the scheduling of cannabis-derived terpenes? Is that also Schedule 6? And I didn't get a response to that, but I think it kind of takes us down a slippery slope in terms of how scheduling of the multitudes of what's in the cannabis plant, the flavonoids, the other minor cannabinoids, and the terpenes, cannot just automatically be lumped in Schedule 6. In which case there shouldn't be a regulatory position on it, perhaps, but that's hard to say. So I think it's just something we had to discuss, because the regulator's view of Schedule 6 took me a little by surprise. I thought it would be more of a vague answer. The answer was very specific. So what are your views on that?
Look, I mean, that's going to disrupt the industry quite a bit. I mean, like you said, broad spectrum, full spectrum. I mean, those are products that are already on the shelf, where people are thinking that it's under the specified exempt cannabis products, and now it actually turns out being a Schedule 6 listing. So in essence, these guys that have these Schedule 6 products now need to get a Section 22C cannabis license.
Yeah,
so,
and they need to get a marketing authorization for Schedule 6. So that's a whole possible, basically.
It's a whole different ballgame. So, I mean, this throws a spanner in the works big time. I mean, I didn't get to sit in on this conference. Unfortunately, I was at the GMP inspection at the facility I'm at now. But I mean, me and Jeff had a brief conversation afterwards. And I mean, I was floored when I heard this news. I was like, what? Really? Minor terpenes are actually falling under Schedule 6? I mean, I can understand.
Well, minor cannabinoids. Minor cannabinoids.
Yeah, minor cannabinoids.
Yeah.
So, I mean, I can understand with the THC side of things, like your THCB, your THCBA. But I mean, your C cannabinoids, so CBG, CBN, CBDA. I mean, it's a scary fact that they're actually scheduling that under Schedule 6. Yeah. I mean, I would at least think under an exempt product, under the 20 milligrams daily dosage, that it would fall under that type of complementary medicine. So, yeah, I think they need to obviously amend the schedules and see how this is going to roll forward in the future. I think this is going to throw a spanner in the works with guys that have products on shelf.
Yeah, I'd say luckily, I think most guys who've put products on shelf have done a CBD isolate with plant-derived terpenes. So they should be safe for the most part. And I think most of the major players have done something along that line. But that said, the amount of minor cannabinoids getting highlighted in the North American markets and those products finding their way eventually across to South Africa, that is going to come into the shelf type of framework at some point. And I mean, let's be honest, I think it's very hard for a regulator to future-proof when there are cannabinoids we haven't even discovered. So to schedule something you haven't discovered, even if we talk about all the additional minor cannabinoids, it's a tough one. But let's jump to the next point that needs discussion. And this was on the reference laboratory. So, I mean, I asked the question again, which is, which approved lab is SAHPRA currently using for post-importation testing of CBD containing Schedule 0 products? And for me, this is an important one because everyone keeps going around talking about the inconsistency between labs. I mean, there's a lot to be said about proficiency testing and SANAS's inclusion here in terms of regulating the space. But I got a very generic response, which was accredited and GMP compliant labs are listed on SAHPRA's website. I know that as well, but I've been to the website and there's 14 listed testing labs, and 2 of them that I know are very active within the cannabis testing space that have recently gotten a SAHPRA approval are not on the website. So firstly, I mean, that probably needs to be updated more frequently from a position. And the other point is I need a direct answer here because I think the industry deserves to know who's the lab. I mean, if we use COVID, and obviously Pfizer's vaccine came in yesterday, and it's at the National Control Laboratory for testing before it's released to the public for use. Now, that's pretty clear. The National Control Lab does that. Is that going to be the same entity that now is equipped to do cannabinoid-based testing? Is it going to be a separate lab? If so, can the regulator communicate that to industry? Because I'm sure everyone in industry would like to use the same lab for testing as the regulator to make sure that your results align with our results, at least until such point that proficiency testing amongst labs is established in the space, and we can feel that we are pretty safe in terms of that method validation in terms of what the next steps are. So for me, this can't be a generic response any longer, especially considering that the SAHPRA's CEO, Boitumelo, has gone out and said there will be a call-up at some point for CBD-containing products that are Schedule 0. Now, if you're preparing for a call-up, you need a reference laboratory. And industry as a whole needs to be able to also access a laboratory of the same standard and alignment to ensure that they are ready for such a call-up, because it would be very unfair to say that their lab is wrong and your lab is right if there hasn't been a proper level of due diligence here in consideration. So I anticipate that there is due diligence. I would just really encourage from our positioning as well to know who the reference laboratory would be for this type of test, because I mean, you've heard this as well. The amount of swings in testing, whether you're testing potency on a GC, and you have to obviously derivatize certain aspects there for the test, or you're using an HPLC. I mean, what is the standard? And I mean, there is no monograph, and we discussed this previously in our last discussion. So if SAHPRA hasn't published a monograph on the standards for testing, I think maybe this is a key linchpin discussion for a reference laboratory, because if there's a reference laboratory, it would make sense to have a monograph to stipulate the conditions around that.
Yeah, and the specifications as well. I mean, pesticides are a massive thing we've been touching on for a while now. I mean, in the States, how many things are they testing for with pesticides?
Oh, depends, you know. Yeah, well, no, I think it's one where they've been looking at 400. I know that Canada, Colorado, and California all have probably in the region of about 100 on that list. But I mean, I haven't checked on that recently. So correct me if I'm wrong in the comments. But it's absolutely one where, I mean, I know of guys that maybe test up to 50 pesticides. But again, we talked about this previously. So, I mean, there's a lot of advice there from the food industry that's put out guidance on specifically pesticides. Let's jump to the next one, which is for me, it's an interesting one. You know, I mean, we've known this. I kind of went into this one asking a bit of a question that I would say I knew the answer to already, but it was one where I see products every day in retail stores. And the one I asked was specifically on honey containing CBD. You know, so if I've got a honey formulation, it contains 10 milligrams of CBD. Is that a legal product or not? Or can it be defined as a complementary medicine? Obviously, it can't. We know this. It's part of why I asked the question. Really, this is interesting because edibles, infused products, beverages that are infused with CBD, anything that is a foodstuff, does not actually fall under really with the scoping of what SAHPRA is there for, which is medicine and complementary medicine. And I don't think I have not seen a lot of discussions that are really addressing enough of the framework around foodstuff, novel foods, and cosmetics. Because in South Africa, cosmetics and foodstuffs, along with disinfectants, falls under Act 54 of 1972. And this one is, I haven't seen much engagement here. I mean, I think it's the Directorate of Food Control. So I haven't seen a webinar I can recall necessarily that really goes into discussions with the Directorate of Food Control on the scheduling of foodstuffs and cosmetics containing CBD. And I would love, if you've seen this, can I please ask you to add it in the comments, because we're always lobbying for more clarity in the industry. But it is a concern because I think the thing we see the most is the CBD products that are not defined as a complementary medicine. And I mean, we can have a separate discussion on these definitions, but you know, food stuff is prolific. I mean, flea markets, major retail stores that are, and I'm not talking about hemp-derived CBD, because there was a response here that was asked by, so I'll go over here the cursor. This was a second question that was asked by a delegate, and I've just excluded their name for their own privacy, even though it was a public event. They asked, will DALRRD, obviously Department of Agriculture, regulate low percentage THC for applications like raw materials intended for cosmetic and personal care products? And then obviously, Ms. Omaji from SAHPRA responded, DALRRD will regulate these products obviously in the scope of DALRRD, but as mentioned, only naturally occurring quantities in the seed or oil obtained from cold pressing, and there was quite a discussion on the definition here of cold press, with low THC excluded from the Medicine Act. That will all kind of, you can read it here, but it basically came down to this, which is any product that contains extracted THC or CBD will be regulated by SAHPRA and will be deemed illicit in food or cosmetics. Cosmetics, food containing any naturally occurring quantities will be regulated by the respective legislations. What that basically boils down to is if it's from hemp-derived sources and it falls within guidance, it's fine. That's why you can buy hemp seed oil off the shelves at Pick and Pay as an example. But when it comes to artificially, or let's just call it extracted CBD, which is the benchmark of how most markets run in the world, it's, you know, in the UK, it's novel foods in that sense. But yeah, this kind of goes into that whole, we need to have a further engagement with Directorate of Food Control, because I kind of see that a lot of individuals are operating under the assumption that if it's under 600 milligrams and 20 milligrams per dose, it's kind of fine to put it into food products. And that's not the case. And this can end up being quite a problem for individuals and companies when it gets called up and enforcement of some sort gets implemented into the industry. So, I mean, I'm sure you share my feelings here and my fears for industry. I mean, the reason we do these videos is to, I mean, we're very proactive about the potential for the plant and the potential of its extracted components in a medicinal framework, but also in a general health framework. But I want to make sure that our clients are safe and protected, and they're not operating on false assumptions or misinterpretations. And that's why I felt it really important just to highlight this once again, that we need to see more lobbying that's not directed necessarily at SAHPRA, that's also directed to the food control aspect of it. Your views, Ross?
Yeah, well, I mean, we obviously touched base on the 9 pillars of cannabis, and this is obviously one of the entities that fell under that. So I think this needs to be looked at extremely, extremely fast. I think this act needs to be amended. Otherwise, there's going to be a lot of problems, especially for this market. I mean, retail is a massive factor with CBD. I mean, honey CBD, they sell a lot of it. It moves off the shelves like fire. So yeah, in terms of that, I think this needs to be amended. I think that the departments need to align a lot better, and obviously amend this accordingly. I mean, if you allowed an oil-based substance that you can put into your mouth, for example, then what is the difference between an edible and an oil? And I mean, a topical cream as well. I mean, if you're putting a topical cream on, I mean, that's not really getting ingested. So how does that affect your health? So I think safety boils down a lot to this entity. I think SAHPRA needs to obviously identify this with Department of Health, for example, and maybe iron this out and get this act amended.
Yeah. Well, I'd like to see some kind of comments, like just clarity for industry. I mean, just to say it's illegal, just to treat it as the dark horse in the family or the dark sheep, it doesn't really resolve the issue, because at the end of the day, we see a proliferation of products on shelves, and consumers are really just engaging with those products. I mean, why would they know any better or know anything more? And I think, based on the trends in the US, in different states, there's quite a lot of, I think safety is pretty clear as a general sense, and without going into clinical trials for it. I think we need to just talk about foodstuff and cosmetic a lot more as a South African community, as an industry community locally, because this is where a lot of the clients might get their initial exposure to the product outside of, let's call it a Schedule 0 complementary formulation. So, no, I'm going to leave it at that. So there were a lot of additional questions on patient right of access, how to accelerate a Section 21 application. I look at models like Australia that's done such a great job in terms of patient access, and there's a lot to talk about that as a separate market. It was also interesting to see the discussions that were on the INCB once again. You and I both know there's a lot kind of that could happen in this space. So what's going to happen with the INCB regulating medicinal cannabis in the international framework and South Africa's limits is a whole thing to itself, but I'm sure this will come up in discussions. I want to jump back to how your experience has been getting ready for tomorrow's audit. Tell us a bit about the preparations in getting ready for tomorrow.
Yeah, so look, obviously I'm at this facility. I wish it was a little bit lighter behind me so you can actually see what it looks like. Beautiful facility. I mean, this is pretty much one of the closest facilities I've seen in terms of GMP. So tomorrow being a gap inspection, this is obviously for them to get plants in the ground. They had their GMP inspection a few weeks back. Look, there was a few things to iron out. I mean, small little nitty gritty things like putting tape on the ground to obviously indicate where you're going to be stepping over, placing step over benches, sanitizing stations, PPE areas, additional signage, waste bins, plant material bins, excess waste. So that type of thing where you start speaking about batch records, and yeah, that's basically it. I mean, there wasn't a lot to iron out. Sorry, I keep looking back because I'm looking at the work that I did in the boardroom to make sure that all my work is done. I don't want to walk in there tomorrow and be like, oh, should I miss something? But yeah, I mean, the team here has done a great job. Now it's up to the authorized representative to have his say tomorrow and see how this inspection goes. So the guys should get you at about 10 o'clock tomorrow morning. Should be about 5-6 hours. Should touch on about 50 different questions, more or less. But yeah, judging by today and the work that I put into the background, it's pretty much there. They're 99.9% there. Yeah, it's up to the small stuff for what the inspectors see. I mean, The inspectors are here to do their job, and they are here to find something wrong. So let's hope we can mitigate that and ensure that there is nothing wrong.
Yeah, no, I agree with that. Yeah, there's a lot I can say here as well because I mean we have seen the issuance of GMP certificates to multiple license sites, and you know I'll reserve this for discussion with those licensed entities. I have a very hard view, I suppose, on what GMP cultivation is and is not, and how that's scoped, and how that's validated within European context. So independent of that, let's move on to, you did do a GMP audit, I think about a week or so ago. Tell me about how that maybe was a little different to like a GACP audit.
That was a beast. Yes, that's sure. Do you know what it was? I've sat in 2 other inspections or 3 other inspections under GAP. For me, because I've sat in on those inspections, they've kind of become like a routine, so I kind of know what to look for. That GMP inspection, I mean, it's 2 days. It's constant validation. Everything is validation. How do you validate this? How do you do your installation qualification? How do you do your operational qualification? All right, fantastic. You've got your HVAC in place. Where's your pressure cascade? Show me your pressure cascade plan. All right, now that you've got that, cool. Does it fall under ISO 8 grade D guidelines? And then the guys kind of look there going, how do we validate that? So obviously you validate that by particle counts.
Yeah.
Doing a dot test. Airflow. How many air changes are you doing? So they touched a lot on HVAC validation. They must have at least minimum had about 60 different questions around the HVAC system. Easy.
Yeah. Now there's a
and installation qualification and operational qualification is massive. That's a huge finding, because if you cannot validate that system, it means you don't have a clean room, which means you should not be processing anything further with an active pharmaceutical ingredient.
Yeah, I mean, there's a lot to say there. I mean, I don't want to get into this too much because, I mean, the way I see it is any critical control point in the cultivation process, the lights, the fans, they all need IQ/OQ. They all need validation. They all need cleaning protocols. They need how you stripping, cleaning, all those associated critical control points. Because at the end of the day, you can't tell me that the soil, the lights, the air, the movement of the air are not critical control points for cultivation. So, I mean, let's stay off that topic a bit long, but I think we've hinted at how detailed it can become and how, you know, there's a lot. I mean, if we're talking about a spinning blade on a fan, does it need to have a rotameter attached to it to validate the speed of that fan? I mean, there's a lot here we can dig into, and I know it's not happening, and I know it probably shouldn't happen, and I think it really comes down to how you review the validation process in GMP versus GACP. But let's move off that and kind of jump to what are you really expecting? So maybe you mentioned some of those questions tomorrow. What are you seeing coming up more in terms of what you're anticipating for tomorrow's inspection?
Look, obviously, master documentation review is going to be a massive thing. SAHPRA always looks at your master documents, so original documentation. So what is your quality management system? How do you manage your quality? Service level agreements, massive factor with getting your GAP license. Obviously, you need to have the correct validation protocols in terms of vendor qualification to ensure that you're dealing with the correct people. I mean, we touched on laboratories earlier. So, I mean, you look at NAFs, for example, that would be a suggestion I would use in terms of laboratory testing. But now, looking back at your previous slide with the guys that are listed on SAHPRA's website, they're probably not even on there. So who would you actually suggest? So service level agreements, third-party contractors, massive factor. Reverse osmosis, huge. That is a huge factor when it comes to not even GMP, but just under GAP. I mean, you look at a GMP inspection, they're looking for pharmacopoeia water. So if it enters your processing facility, it needs to fall under pharmacopoeia. If it's not going anywhere near your processing facility and it's only going to your plants, then you obviously need to start looking at SANIS accreditation 241 drinking water. So it shows you the massive variety that needs to fall in place for the GAP.
You know what, Ross, I'm going to jump in there. I mean, if we're talking about your packaging, what about extractables and leachables that relate to the use of the packing material? You know, We haven't spoken, I mean, stability side is more about the final product or the API going to certain markets. It depends on the market. But there's a lot. I mean, extractables and leachables, I'm sure that's not even coming up as a discussion.
No, it's not. I mean, even in-processing testing. I mean, an in-process test, you as a cultivator, I mean, you should be doing moisture analyzing to ensure that your product is at the correct moisture level before it starts getting sent to the trimming room or the curing room for that matter.
Yeah.
And I mean, in-process control testing is a huge factor.
Yeah.
Even under GAP.
Well, this is the thing. Let's not give the regulators too many ideas and too many questions to answer the discussion tomorrow. But I'm sure this will only go live tomorrow when the inspection's underway. But I mean, I agree with you. Increasingly, it depends on the markets we're going to. It's up to the client to make sure that for the market they are targeting, that they are appropriately prepared, validated for those markets, and are able to tolerate the scrutiny of an international audit to that standard. So, I mean, this is something that's constantly evolving. The space and the knowledge is evolving in it. I hope that we are hopefully positively adding to that and engaging with industry and with regulators and with everyone to try and facilitate a successful industry. I mean, that's ultimately what we want to see. I mean, we want to see the industry thrive. We want to see the plant thrive. We want to see even what happens next in psychedelics. We want to be able to facilitate that transition for how do we, firstly, I mean, most markets go through a medical framework and then an adult use framework at some point. It's not necessarily always the way it's preferred, but it is the way it tends to go. So, tracking of history, we're trying to just make sure that there's informed and more content available in the South African context. And again, encourage comments, questions. This is something we always highly push for because increasingly we want to see more forums, discussions that are of a high caliber, that address the industry. And there are so many people with specific knowledge that really facilitates and builds on what's happening currently in the space. So Ross, I just want to thank you once again for your time. I know we tend to have a lot of discussions, but I enjoy the level of the engagement, the level of the conversation we are having. I hope that obviously relevant parties do view the content, and please feel free to ask any questions in the comments. We're here to facilitate feedback as much as possible, and that's ultimately our objective. And Ross, I wish you the best of luck for tomorrow. So
thank you.
We'll be talking again soon. I know that we still haven't forgotten about our discussion or our desire to discuss genetic input materials, seed registration, how that's structured, certain standards within genetic material and seeds and clones. So there's a lot for us to still discuss, and I think there's so much scope that I still want to cover in this space. So thank you again, and thank you for everyone who's made it to the end and watched, and we look forward to our next discussions. Thank you, everyone.
Thanks so much, Jeff. See you soon.
See you soon.